Imagine you are lost at sea. You're in a lifeboat in the sea of self pity and fear. Your only paddle is a tennis racket. Occasionally, on a good day, when the fog that surrounds you lifts up, you can see shore, freedom. At night, you can hardly sleep, for the fear that the current could pull you further away from shore shakes you down to your core. This is how an anonymous online user described their depression via the website Reddit. Now, depression and various health related disorders are an epidemic in the United States right now. And currently, the most popular form of treatment comes in the form of SSRIs, or selective serotonin reuptake inhibitors. Now, selective serotonin reuptake inhibitors, about 20% of Americans are taking these right now. However, they only work about 50% of the time. And when they do work, they often come with very undesirable side effects. For example, impotence in males is a very common side effect of SSRI treatment. Now, a beacon of light in the fog is psychedelic psychotherapy. And it's a relatively new form of treatment in terms of mental health. However, it's showing great promise as of right now. So, psychedelic psychotherapy is showing to be more effective than SSRI treatment, and it doesn't come with the nasty side effects that often do come with SSRI treatment. So, today I'll be breaking down what exactly psychedelic therapy is. I'll describe how MDMA is being used to treat PTSD, and I'll discuss briefly how magic mushrooms are being used to treat depression. Now, what exactly is psychedelic psychotherapy? Well, psychedelic psychotherapy is a hybrid form of therapy combining the use of a psychoactive chemical and more traditional therapy treatments. So, treatment is usually done in this sort of general format where a patient will be taking a psychoactive chemical. Usually, they put on a blindfold and they'll have some headphones on and they'll be listening to some calming music, generally selected by the facilitator. And the facilitator doesn't do anything, they don't interfere throughout their psychedelic experience at all. They're just there to keep them safe. Now, after the psychedelic experience has died down and the patient has sobered up, then the facilitator will begin to ask questions to the patient, such as what emotions they felt, what sort of introspective experiences did they have on their psychedelic experience. And then they'll begin to sort of extrapolate and begin to discuss with the patient how this could be applied to their everyday life and how what they experienced and what they felt could be related to the problems that they're experiencing every day. This is the sort of general format of psychedelic psychotherapy, and depending on what kind of treatment and the severity among various other variables, um, there will be follow-up meetings, maybe once a month, maybe twice a month, and so on. Now, the first form of psychedelic psychotherapy that I would like to discuss is how MDMA is being used to treat PTSD. Now, PTSD is a very common mental health disorder for those who experience trauma. Usually, sort of expresses itself in the form of hypervigilance, numbness to emotion, and flashbacks to whatever traumatic event was experienced. Now, there's been research done in the year 2019 that kind of showed that PTSD is often associated with low levels of oxytocin in the brain. Oxytocin being the neurotransmitter, the chemical that kind of regulates stress and calmness and feel good feelings. And so you cannot simply just give oxytocin to an individual experiencing PTSD like symptoms, because something called the blood brain barrier in your body is going to prevent that from happening. However, what you can do is you can trick the body into creating more of its own oxytocin, and that's exactly what MDMA does. So, when an individual takes MDMA, their brain begins to produce more oxytocin and they begin to be put into a more calm and less stressful state. So, in a psychedelic psychotherapy setting, the user and the patient becomes more calm, they become more stress-free, and thus they become more receptive to the traditional therapeutic treatments that are often provided by the facilitators. And of course, with follow-up meetings and sessions, the symptoms of PTSD seem to go away. Now, most people so far who have been a part of this MDMA PTSD research have had significant improvement in their symptoms. And in fact, about 20% of them were able to go back to work, whereas previously they were not able to work at all due to their symptoms and how severe they were. So, right away, we are seeing just how impactful MDMA can be in terms of treating PTSD. It's showing great promise. However, a little bit more research is need to be done, but I think it's safe to say that as of right now, I think this is going to be a new form of treatment in the near future. Now, the next form of psychedelic psychotherapy I'd like to discuss is how psilocybin magic mushrooms are being researched in treating depression. Now, magic mushrooms are different from MDMA in the sense that they don't produce oxytocin. Rather, they produce serotonin in the brain, which has very similar effects as to oxytocin. However, there is some more nitty-gritty, very scientific nuances that I do not have time to discuss at this moment. Now, in a similar way, being a psychoactive chemical, psilocybin mushrooms also stimulate more synaptic connections in the brain. And furthermore, they also really encourage and evoke that very introspective emotional experience by whoever takes the substance. So, in a similar fashion to MDMA PTSD psychedelic psychotherapy treatment, a patient will be taking some psilocybin, synthetically produced. It's never really found organically in an actual mushroom in these clinical settings. And then be blindfolded, we'll be listening to some music, and then after their treatment, we'll begin to discuss their introspective experiences with the facilitator. Now, significant improvement was shown in these depression-like symptoms. There's a scale used to measure how severe an individual's depression-like symptoms are. It is the MADRS. And the scale ranges from 0 to 12 points. We saw a 50% improvement in the points of individuals who took the independent variable of the psilocybin during their treatment. Now, however, there is something to be said that those who were a part of the psilocybin trials, they did experience some other side effects such as nausea and dizziness, and some of their symptoms did return up to 12 weeks later. However, there was still the general trend of improvement there, and the side effects that were experienced by those who took psilocybin were still, in a more objective sense, much more preferable to those that would normally be experienced by those experiencing SSRI treatment. So now that I've just discussed psychedelic psychotherapy treatment using psilocybin mushrooms for depression, let's go ahead and review everything that we've just learned today. Today, you learned a little bit about what psychedelic psychotherapy is. You learned a little bit about how MDMA is being used to treat PTSD. You learned how psilocybin mushrooms are being used to treat depression. Now, this is a very, very important and impactful topic in the United States right now, as currently about 20% of Americans are taking SSRIs, and they only work about 50% of the time. So if we have the potential to treat these mental health disorders more effectively without any of the nasty side effects, or at least with less severe ones, then this is going to revolutionize the mental health epidemic that is currently being experienced in the United States as of right now. So, a beacon of light in the fog. Although psychedelic psychotherapy may not instantly pull those who feel adrift right into shore, it's going to give them a stronger paddle. And more importantly, it's going to give them hope. And not just the patient's hope, it's giving their loved ones hope.